Good morning. Welcome to this morning's forum on the topic of Zika. My name is Daniel Perez. I am the dual enrollment specialist at South Texas College, Starr County campus, the moderator for today's forum. On the behalf of South Texas College, Starr County campus, I want to welcome everyone. Last month, the World Health Organization reported Zika is no longer a global emergency. However, they say the virus remains a threat. A recent flurry of news on dangerous mosquito-borne viruses known as Zika has the Rio Grande Valley on alert. Last week, Texas confirmed the first local transmission case in Cameron County. Our goal today is to help address community concerns with updated information on the virus of local measures to inform and protect residents. To my left, we have a qualified group of panelists who will cover an array of information about the Zika virus, including what is the Zika virus, how it is transmitted, what are the health concerns, what are the most effective preventions, and what are our public health officials, government, and leaders doing to mitigate the threat this virus in Starr County. To begin, let's welcome a panelist and have them briefly introduce themselves.
Good morning. I'm Dr. Jose Vasquez, and I am the health authority for Starr County.
Good morning. I'm Dr. Ron Tyler. I'm the Regional Public Health for the Department of State Health Services, Regional Public Health Veterinarian.
Good morning, I'm Eloy Vera and I'm a Starr County judge.
Good morning, my name is Jorge Benavides, Starr County Fire Marshal.
Good morning, I'm Joel Villarreal, Mayor of the great city of Rio Grande City.
Good morning, my name is Abiel Sainz. I'm the Vector Control Officer for Rio Grande City.
Thank you. I will now ask our first panelist to get started. We'll proceed through the end of the table and take questions and answer from audience at the end of the presentation. Sir.
Thank you very much. Thank you, all of you, for giving us the opportunity to make this presentation to you all. I know that your time is valuable, so I'm going to try to keep this as brief as possible. I do have sort of an extensive presentation. I'm going to try to go through it as fast as I can and to try to point to whatever is more important for the general public as well as for healthcare providers. I am going to be focusing a little bit more in the medical aspects of this disease as well as some technical issues that are important for healthcare providers to be aware of in order to face in an effective way the spread of the disease. So first, in the introduction, what is the Zika? Zika virus is a virus that is spread to people through mosquito bites. There is two different types of mosquitoes that are able or capable of transmitting this disease. Unfortunately, those are the two most prevalent mosquitoes in all of these endemic areas. They are the same mosquitoes that transmit other febrile illnesses as dengue and chikungunya. Okay, so that's an important factor because one of the main tools that we have to prevent the spread of the disease is throughout the control on the proliferation of mosquitoes and avoiding the bite of these mosquitoes. The Zika virus infection during pregnancy can cause severe damage on the babies. That's why this is important. As our guest mentioned, the Worldwide Organization for Health Services has said that Zika virus is no longer of an immediate threat. However, I will bring this to an individual level. If an individual acquires this disease and that patient is to be a pregnant lady, that will mean the war for her. So the fact that it's not a reason of major concern worldwide as an endemic disease doesn't mean that it's not important for every individual case in specific. Before the 2015, Zika outbreaks occur in different countries of the world, mainly Africa, Southeast Asia, as well as the Pacific. Later on, this disease had spread through the world, being now the Americas one of the main places throughout the world where do we see this disease. The spread and the symptoms. How is the Zika spread? It can be spread mainly through mosquito bites, but from a pregnant woman to her baby, sex with an infected person, or in personnel who works in laboratory or in hospitals through exposure of body fluids. The Zika may spread through blood transfusion, however, this has not been documented. And there are no reports of Zika virus being spread through breastfeeding. So we are still encouraging breastfeeding that's not a contraindication in this case. So how does the Zika affect people? Mostly, this is just a mild viral illness. Causes fever, rash, conjunctivitis, joint pain and swelling, as well as some other symptoms like headaches and body pains. People usually don't get sick enough to seek doctor's attention or the need to be hospitalized. And very, very rarely, a patient is going to die of Zika. The symptoms as described, muscle pains, headache, but there is 4 main symptoms, is fever, rash, joint pain, and conjunctivitis. Zika and pregnancy, that's what is bringing us all here. The Zika virus can pass from a pregnant woman to her fetus during the pregnancy or around the time of birth. It is not known how often does it happen, meaning of this, not all pregnant women who are being infected with Zika are going to have babies affected by this disease. The infection during pregnancy is a cause of microcephaly as well as other severe brain defects. There are other problems as well as miscarriage, stillbirths, and birth defects associated to the transmission of this disease, and there is no evidence of a past infection will put that patient at risk for having a future problem in subsequent pregnancies. There is something called the congenital Zika syndrome, and it englobes about 5 different birth defects in babies, being the most important one, the severe microcephaly, which is a baby with a smaller head than what is normal for a baby on that age. There is a decreased brain tissue and brain damage with calcifications. There is damage in the back of the eye, and there is other congenital problems as joint motion defects with club foot. There is too much muscle tone restriction in body movement after birth. All of those are the 5 different clinical presentations of a baby with Zika syndrome. How do we assess a pregnant woman for possible Zika exposure? In a prenatal visit, all pregnant women should be asked if they have traveled to an area where Zika is endemic, or if they have had unprotected sex with a partner who had traveled to an area that has been recognized as an endemic area. Guillain-Barré syndrome is a neurological condition that we see associated to viral illnesses, and it has been documented that could be associated as well to the Zika virus. Does the Zika cause Guillain-Barré syndrome? The answer is yes, but in a very few cases. The testing for Zika. Who should be tested for Zika? And there is where the situation gets a little bit more complicated. Since this is a disease that is relatively new for us, we are still learning from it, and we are coming with recommendations basically on a weekly or in a monthly basis. The CDC has updated their recommendation on who should be tested for Zika virus basically on every week over the last few months. In general, anyone who has recently had Zika symptoms, fever, joint pain, conjunctivitis, rash, and lives in or have visited recently an area that is endemic for this disease, or people who had the symptoms and had a sexual partner that had traveled to this area so that had the symptoms, as well as all pregnant women who have lived or recently traveled to an area of Zika or had sexual intercourse with somebody known to have the disease or somebody who has traveled to the endemic areas. All of that people should be tested for the disease. How do we diagnose Zika? The doctors or the healthcare provider will request a specific test that should be done in a lab that is being approved by the CDC or the local Department of Health. Not every single lab can perform in the adequate manner this testing. A blood or a urine test can confirm the Zika infection in an specimen that is collected early in a person with infection. What to do if somebody gets infected? There is not a specific treatment for this disease. This is a viral illness, and most of the cases used with symptomatic treatment through Tylenol and overall rest, hydration will take care of this disease. Drinking fluids is important, rest is important. It's also important to mention that we should not indicate non-steroidal anti-inflammatory medication to treat the symptoms of the disease in kids due to the possibility of something called the Reyes syndrome, and in adults due to the possibility of a cross-contamination with other infections like dengue, where the use of anti-inflammatory medication could represent a hemorrhagic risk. What to do if somebody is sick with the Zika virus? First, and most important, is to protect yourself from being bitten by mosquitoes. We are trying to prevent the spread of this disease. So nothing is going to stop you from having that disease at that point, but we could do something to try to avoid the spread of this disease, preventing to be bitten by mosquitoes. The virus also can be passed from an infected person through body fluids. So avoid having sexual intercourse or unprotected sexual intercourse during the time that this patient is sick, and up to 6 weeks after in case of females, and up to 6 months after in case of males. The surveillance of this disease. The healthcare provider that have identified a potential case of Zika virus infection should report these cases to the local and state authorities. This is an important point in this presentation, that the local Department of Health as well as the state departments of health should be involved at every single level on this process. Pregnant women who had any possible lab evidence of possible Zika infection should be reported to the U.S. Zika Pregnancy Registry. Prevention. What to do to prevent this disease is mainly to protect us from the mosquito bites. So we have to do all of those different measures that somebody else is going to explain later on to try to prevent the mosquito bites. So avoiding going outdoors during the peak times where these mosquitoes are more active. And the Aedes aegyptis are more active during the daytime, but they also bite at night. They are more aggressive during daytime. So we have to avoid going outdoors during these peak times. We should wear long sleeve jackets or shorts, use mosquito repellent, trying to avoid basically the exposure and the bite. At home, use mosquito nets, avoiding to keep windows or door open in the house, and basically avoiding the mosquitoes from being entering inside your house. As mentioned, the Zika is spread by the Aedes aegypti or the Aedes albopicus mosquito bites, and we need to take different steps to prevent this. Preventing these mosquitoes from reproducing is an important issue, so we have to avoid stagnant water, pools, flower pots, toys that could contain water after rains, anything that could be a water reservoir that will remain stagnant in the outdoors, where mosquitoes could put their eggs and then reproduce. In all of these slides is just mentioning about the different barriers, methods that we have to prevent the mosquito bites. The prevention through the sexual transmission. As we have explained, sexual intercourse is a different way where the Zika virus can be transmitted. So the use of barrier methods, condoms for male or female, it is recommended to prevent the spread of the disease in people who live in endemic area or who have traveled to areas that are known to have this disease. Not having sex eliminates the risk of getting Zika from sex, and the condom use decreases the chances of getting this disease. People who have partners who have traveled to endemic areas should be concerned, especially if the traveler is a female, for at least 8 weeks after the travel, and in cases of males, for at least 6 months after the travel. They should be aware of the potential of carrying this disease and the potential of causing harm to their babies if during that period of span they were to get pregnant. If you're thinking about having a baby, in case of women, to wait at least 8 weeks after travel to endemic areas. In case of males, at least 6 months after the travel into endemic areas. Prevention in traveling. If you are pregnant, do not travel to areas that are well known to carry this disease. Pregnant women should talk with their healthcare provider and consider postponing non-essential travel to areas that are being affected by the disease. If you travel to an area endemic with Zika, you have to follow a strict control to prevent the mosquito bites, and you should restrain or abstain from having unprotected sexual intercourse with somebody who lives in an endemic area. I'm going to go through this. There are endemic areas within the United States. The South Florida, the Miami-Dade County has been declared an endemic area in the United States, and that's the first one that the CDC have declared as an endemic area within the continental United States. Okay, I'm going to just change. This tool that we have here to the right side of the screen, pregnancy and Zika testing, is a tool that the CDC has designed to help the healthcare providers to determine whether a patient at risk of having contracted this disease should be tested or no. I am going to go through the different scenarios that it has, basically to teach the healthcare providers how to use this tool in the time that they have to determine whether patients should be tested or not. So clicking here in the Starr button to the right-hand side, it gives you a different option, whether you are a gynecologist or you are a family physician, nurse, or any other healthcare provider. So let's say that if we were to be a family physician, we click. It gives you different choices. If you want to have just information, if you need information how to test a patient or what to do after results have come to you and they are positive. So you keep going next and you decide whether you need to have information to prevent or the spread of the disease, or you need testing, or you need to know how to manage a patient that had already been diagnosed in an initial testing as a positive. So on and so forth. So the basic importance of this tool is that it helps us to determine in a more clear way how to manage a patient with a potential risk or with a positive test for Zika, especially for pregnant patients. This is important because, as I mentioned before, CDC is updating their recommendations basically on a weekly basis. So it's difficult to keep track of who should be tested, who shouldn't be tested, what do we have to do with those patients or no without these tools. So I invite you all to go through them later on, especially all of you that are in the healthcare work, and to know that we have this tool available to help us to determine whether a patient should be tested or treated in a different manner. If there is anything else, I will let Dr. Tyler continue with this, and we'll be glad to answer questions at the end of this forum. Thank you.
Can you hear me? Okay. I just have a little presentation. I was going to get on the controls, if that's okay. There's a video that I wanted to jump to in different parts of the video, so if it's okay with you, I'll just go ahead and do that. This is a little table that's taken from the fundamentals of virology, or the foundation of virology, written by Dr. Frederick Murphy. Can you hear me? Is this mic working? I'm sorry. We'll trademark mics. Can you hear me now? Okay. So this is a table that was taken from the Foundation of Virology, written by Dr. Frederick Murphy, and it talks about the very first viruses ever discovered. And the tobacco mosaic virus, going back to your biology 101, was the very first virus ever discovered. But I wanted to show you this virus right here, the yellow fever virus, right here, discovered by Walter Reed in 1900. Does that name ring a bell? That was the very first human virus ever discovered. The next, virus, human virus discovered, you'll see, is the dengue virus in 1907. When we talk about viruses that are transmitted by mosquitoes, you can kind of break them down into three different groups: your alpha viruses, your flaviviruses, and your orthobunia viruses. And flavus in Latin is yellow. So the flavus virus, the very first one, was your yellow fever virus. And that every virus ever discovered in that group gets its name after the yellow fever virus. These flaviviruses include dengue, West Nile, Zika, St. Louis encephalitis, Japanese encephalitis, and many, many other. I think there's a Rio Bravo virus. There's a whole bunch of different flaviviruses. The alpha viruses include things like Eastern equine encephalitis, Western equine encephalitis, Venezuelan equine encephalitis, chikungunya. All of them are zoonotic diseases, meaning that they can go from non-human animal to human animal. And there's a whole host of other non-viruses, such as malaria, elephantiasis, and heartworm disease. Anyone have dogs here? Do you give your dog a monthly heartworm preventative? And it's a filariid worm, kind of like elephantiasis, but it targets the heart. The worm likes to grow in the heart. So just going back, doing this history, this is a picture of me. There's a picture of me taking a picture of a picture. Right? This is taken at Cameron County Health Department. If you ever walk into their building, you're walking down the hallway, you'll see this poster, this picture hanging up. And this is Dr. William Gorgas, and I want to use this to highlight the history of South Texas in flaviviruses. Dr. Gorgas was a physician that graduated from Bellevue Hospital. He was born in Mobile, Alabama, and he joined the United States Public Health Services, and his first station was in Fort Brown in Brownsville, Texas. And when he came here, he got yellow fever virus, and he survived it. He got over it. And then his next station was in Havana, Cuba, with Walter Reed. And he and Walter Reed and a guy named Carlos Finlay, who was a Cuban physician, those three together, I think, are kind of three key factors that first discovered that yellow fever was a virus, and Walter Reed proved that, and Carlos Finlay said, I think it's transmitted by mosquitoes, and then William Gorgas said, okay, well, if it's a virus and it's transmitted by mosquitoes, let's do things to protect humans from mosquitoes to help control the disease. Let's separate sick people from viruses so they don't keep perpetuating the disease. Let's prevent healthy people from getting bitten by mosquitoes to keep them from getting the virus. And then let's do things to destroy the mosquito habitats so that the population of mosquitoes decrease, and let's educate people about mosquito bites. And he and Walter Reed, working collaboratively, eradicated yellow fever in Cuba, and then he was sent to Panama and he eradicated it in Panama, and he went on to become the U.S. Surgeon General. He's quite a famous individual in our U.S. history. So I think, is this mic coming in and out? Can you guys hear me okay? So this is that video that I wanted to show you. When we talk about preventing mosquito-borne diseases, we always go back to the fundamentals that Dr. Gorgas taught us years ago. And this video here was published, I think, in 1947 or 1940s. And it always reminds me of a Disney video, kind of like a Disney documentary or whatnot. But it was produced by the U.S. Public Health Services. You can go to YouTube and search dengue, it's up to you, yellow fever. And it's, again, it says Office of Malaria Control in War Areas, Atlanta, Georgia. That went on to become the CDC. It was a division of the U.S. Public Health Services. And this video here basically goes through and talks about the response a city in Florida, Tampa, did in response to a dengue epidemic that they were dealing with. And it talks about the different types of activities that they did. So I'm going to skip ahead.
By sea, all routes lead to this southern city. Beautiful scenery and sunny skies attract many additional residents each year.
Doesn't that sound like a old Disney documentary?
For one of man's worst enemies, the Aedes aegypti mosquito, carrier of dengue and yellow fever.
All right. So they did a lot of news releases, a lot of media releases, doing public service announcements about how to prevent mosquito bites and how to decrease mosquito breeding habitats. They enlisted the Boy Scouts and the Girl Scouts, and the Boy Scouts would go out house to house and do these little environmental assessments and give out little stickers for V for victory, against dengue, and they could put them up on their window. But they would go around the house looking for any standing water and show people where standing water was, and they would drain the standing water. They would pass out a lot of educational pamphlets.
To every home, together with an instruction sheet showing methods of destroying their breeding places and posters urging definite action.
So it always, these are the wigglers. This is a Boy Scout demonstrating these little mosquito larvae, and they go around the house, identifying different breeding sites.
And should be immediately tires. They should be stored in dry.
Tires in South Texas are one of our biggest culprits for storing standing water. Merchants and city streets got involved and did a lot of public health educational efforts.
Thousands of people.
Anyway, so that was that little thing. I think Dr. Vasquez covered this quite extensively. As far as populations at risk, pregnant individuals, Zika, West Nile virus, your elderly individuals, people that have had organ transplants, immune compromised, and then chikungunya, dengue, and Zika. Anyone that's going to tropical areas are at risk of picking those up, and then, as Dr. Vasquez says, bringing them back, and then we try to enforce those Gorgas principles of if you get sick, don't get bit by mosquitoes, so you don't transmit it to our mosquitoes. So different types of mosquitoes transmit different types of diseases. Culex is your big West Nile mosquito. Aedes aegypti and Aedes albopictus, Aedes aegypti especially, is your dengue, chikungunya, Zika mosquito. The common name for Aedes aegypti is the yellow fever mosquito. And I always like to joke here that males feed on flower nectar, and it's only the female mosquitoes that feed on blood. So the males are sugar and spice and everything nice or something like that. So I think Dr. Vasquez covered this. And then this is as of October 18th, 2016. It can be updated since last week we reported the first locally acquired case in Cameron County. Different agencies, Rio Grande City assists us, and Laredo, Webb County, Corpus Christi, Nueces County, Kingsville, Claver, Cameron County, Hidalgo County, all these different agencies will oftentimes do different types of mosquito surveillance, and we work with them in doing mosquito surveillance. And mosquitoes will be trapped, and then these mosquitoes will be sent into a laboratory where they'll be tested for different types of viruses, such as dengue and Zika and chikungunya and West Nile and whatnot. And we've yet to see a positive Zika case. We've had positive West Nile mosquitoes, and we've had positive St. Louis encephalitis mosquitoes. And I do think this trapping is quite valuable. As we do our surveillance, it seems like, I would say, from the time we get a positive West Nile mosquito report, it's usually about a week to 2 weeks later, we'll see a positive human case. And so I think these trappings are useful, but it's important to, if we get a positive mosquitoes, to let the public know that, hey, we have mosquitoes out there carrying the virus, protect yourself. So again, these Gorgas principles of prevention, draining, targeting, standing water, all the different places. There are different, for water that can't be drained, you can use these BTI dunks. It's a bacteria, it's Bacillus thuringiensis israelensis or something like that, that targets mosquito larvae and destroys them. And then we've done a lot of PSAs, and you probably have seen this on your TV screen. You've seen this on your TV at home?
Don't give Zika a biting chance, Texas. Protect yourself from mosquitoes. Remove standing water on your property. Put screens on windows and close doors. And wear long sleeves, pants, and EPA-approved insect repellent. Learn more at texaszika.org.
And then back in 2012, when there was a big West Nile virus epidemic, something like 2,000 individuals got West Nile that summer, and I think there was 90 deaths.
Use insect repellent when you go outside.
Associated with West Nile
Drain standing
virus.
water. Wear long sleeves and pants at dawn and dusk. And keep screens on doors and windows. People older than 50 or with underlying health problems are most at risk for getting ill from the virus. Learn more at txwestnile.org.
So there's a whole bunch of different activities that can be done. Again, lots of educational material, and as always, just keep reinforcing those Gorgas principles, what I call the Gorgas principles. Stay indoors if you're sick. Go see your physician if you think you have a mosquito-borne disease so you can get tested and it can be identified. Don't get bit by a mosquito. Safe sex practices. And then the Far Side cartoon, I just wanted to point out that I'm a big fan of Gary Larson. but he was even accurate there because it's Betty, not Bob, right? So that's all I had. So I'll pass it on to Judge Vera.
Thank you so much. Can you all hear me? First of all, I want to thank you all for taking time to be here, and also thank South Texas College for their generosity in letting us use this fine facility. I also want to thank Dr. Tyler and Dr. Vasquez for coming, and I'll speak on my behalf, to educate me on this virus. So I guess my job is to inform you all as to what we're doing now that we know we have this situation in our community. What is the county doing, and what do we ask of our citizens? Well, first of all, we have been trying to inform our citizens by having radio interviews. We've had TV interviews, we've had newspaper articles, and it's on our webpage. And we're trying to get the word out there that we don't want this problem to be a bigger problem than it already is in Starr County. We also need the help of local groups, civic and organizations to spread the word, but more importantly, you all, the health providers, because you all are the ones that are be seeing more people and touching their lives as far as health is concerned. So we need for you all to relay this message as to what we just heard about the seriousness of this disease or virus. What is the county doing? Well, we've acquired several, tools to cut our tires. We quarter them. That way, hopefully, there's no water standing in them. If y'all have any tires or know of anyone that has tires in numbers, or even if it's just a couple, take them to our transfer station, and they will be quartered up and disposed of properly. So that, I think that's the biggest problem that we have here in the county is tires. Commissioners have been going around the county roads, picking up abandoned tires that people go and throw on the side of the road. And some of our commissioners have tire cutters already. Others that don't are taking them down to the transfer station, and we're trying to dispose of all tires as best we can. All the commissioners also have crews that are going around the community and informing people of stagnant water, that they need to get rid of it before anything else can happen. However, it's very difficult to reach everyone out there, so this is why I'm asking that you all please help us. This, I guess, use the cliche, it does take the village to solve this problem. We need for everyone to get out there and tell our people to get rid of any water containers that they have. We're also trying to gather information any way we can and pass it on to our citizens. But I cannot overstress the fact that even though we're trying using all kind of media, there's nothing better than when a comadre or a neighbor or a relative tells you, hey, you need to get rid of that water because it's a danger for my kids, for myself, and also for you. So, again, I ask you for that, and any questions that certainly the county can work with or help you, give us a call. If you see a problem area, give us a call. We'll send whoever needs to go out there and see if we can take care of this problem. But again, as I told some people out there this morning, I'm here to learn because this is all new to me. And again, I thank the doctors for the information. It's really very valuable. Thank you all very much.
Good morning, and thank you for the invitation also. Pretty much Dr. Rosses, Dr. Tyler covered most of the information that we need to know, and also Judge Vera at what the county is doing to inform the public, our citizens, about the Zika virus. We started to disseminate information around October, more or less. We went through our local radio station, newspaper, also with Mr. Sarabia, our emergency management coordinator, and public relation officer, Ms. Fuentes, who takes care of the social media, I mean, we're trying to get this information out and get the public informed on how we can help at our houses with stagnant water, how to prevent it, what to look for. Like I said, thank you very much, and pretty much all the information was given out. So.
There must not be anything left for us over here. But all kidding aside, just wanted to, on behalf of Rio Grande City, I wanted to thank Dr. Vasquez, certainly Dr. Tyler for being here, certainly STC for allowing these facilities here, and of course, all the rest of our panelists, Judge Vera, Mr. Science, and everyone else here. Again, because at this point, the old adage, an ounce of prevention is worth a ton in gold. And really, those are things that, from a city's perspective, I urge the public to help us out and do your part. I know we have some literature out here at this table as you're heading out, and it looks something similar to this, and it's following simple steps that Texans can do to prevent Zika. And I know it was already mentioned, but I cannot stress the value in this for the residents. What can we do as private citizens to address this? And that's crucial. Certainly the standing water was mentioned. So going around your own houses, our own houses, to see what is out there, doing an assessment. Do we have standing water? It could be, like it was mentioned, a tire. It could be a vase. It could be even in the water bowl of your pets. If you're not changing the water, let's say, every other day, mosquitoes can be those breeding grounds. So again, I cannot stress that enough. And if you can go ahead and get some of this literature, pass it out to some of your patients or clients or out in the community. I know we're going to do our end, and we have our Vector Control Authority, Mr. Science, here to address some of the points that the city is doing to combat Zika. But I cannot, going back to what I said, I urge the public and those watching later on when we put this on the Access channel to help us in this cause of fighting Zika, because it is certainly a virus that, as was mentioned prior, there's some serious consequences, and these are things that we can all do to protect Rio Grande City, the county, and everyone else, all of us. Also, our neighbors in Mexico as well. We have some visitors here from Mexico too. And what is it that they can do, because we live in such a close proximity and this whole region is affected. So again, and here at the college as well, and certainly passing out this information to the students, to the staff, and all the different agencies here in Rio Grande City. And just to reiterate some of those for the public later when we put this on the Access channel, certainly an insect, should I say, repellent, wearing pants and long sleeve shirts when you're outside, particularly during the day, because this mosquito is more active an active biter during the day. Using screens or closed windows, remove standing water, going back to that, and all doing the assessment around your houses, covering trash cans or containers where water can accumulate or collect, and certainly talking to your health professionals, of course, your doctors, your PAs, your nurses, and talking about any of these symptoms. And with that, again, going back to urging the public to help us fight Zika. And with that, I'll turn it over to Mr. Science, our Vector Control Authority.
Good morning, folks. I want to thank Dr. Vasquez and Dr. Tyler for bringing us all this information to us and stuff. I'm just going to talk a little briefly about what vector control is. We actually, if we get a call, and what we normally do is go to the site of the call, and we do surveillance on the site. And that being said, is that we take account of adult mosquitoes that stand on us or on me or whoever's on the site. And from there, we usually determine if there is mosquitoes. We try to tell the persons to let them know where the problem is, if they do have them in their property or their neighbors and stuff. We do trapping also. We do send the mosquitoes to Austin to get them checked out on lab in Austin. We actually got some lab results here a few weeks ago from Austin. We're negative on Zika here in Rio Grande. So, but we do have the vector which creates Zika, which is Aedes aegypti. We do have it here with us. So, other than that, we do larviciding, which we go and all the problems that we have throughout the town. We got several problems that like retaining ponds and stuff like that we do larviciding. Larviciding is it's an insecticide that we pour on the pond, and we kill the larvae instantly. We get 100% kill there, and after that we do the adulticiding, which is spray, which some of you guys probably know that, you know, they spray along the streets with the truck and then equipment and stuff. Other than that, that's mainly what we do. We try to do 100% kill, like I said, on the larvae side, so that way we don't spray as much as we're supposed to. And other than that, I wish, like, there's people that they do. I have no idea if it's they throw illegal discharge water, like from a washer and stuff like that, to their backyard, just to, you know, to water their lawn, I guess, or trees and stuff like that. And that's a big no-no, because we do have consequences on that, and the vector creates there, and we have a habitat and stuff like this. So I do encourage for you nurses and doctors to, you know, to tell your patients on that behalf, not to throw the water, you know, and stuff like that, and illegal way. Other than that, that's what we do here in the city.
We also have with us Mr. Gilbert Milan, who's the Director of Planning. So if you have any questions regarding what the city is doing, or if you want any type of information, Mr. Gilbert Milan is here. You would contact City Hall. We also have our city manager, Mr. Perez, of course, is contacting them at City Hall to have any questions. I mean, if you need an assessment, we'll go out there as well, because these are things that we need to do, of course, to control this. So please feel free to contact City Hall. Mr. Milan has literature as well under code enforcement, and he will visit with you and have that conversation as to any concerns that the public has out there regarding this Zika. Is there a question, Beck?
Yes, sir. Good morning.
Hi, good morning.
What would be Mr. Milan's contact number? If
Sure.
we were to find him? Hi, good morning. My name is Marisela Contreras, and I'm here from the Rio Grande City School District. Hi.
Hi.
What would be Mr. Milan's contact number if we had to call him for a certain situation?
Yes, 956-488-8728.
I'm sorry.
It's 488-8728.
More than that to answer any questions about housekeeping. Properly get it.
Thank you, Mr.
I'm
Perez.
sorry. Good morning. Some of the most common housekeeping comments or, you know, concerns we address at code enforcement level is get rid of stagnant water. You know, like Mr. Sainz said, get rid of illegal discharges. Believe it or not, a lot of people, like he said, you know, do water their garden with their, you know, either washer or the kitchen sink, which is the biggest no-no. Creates stagnant water, thus spread mosquitoes. And also we monitor houses with tires on their backyards, trying to get rid of them, and in any possible way that would increment this type of disease. Thanks.
So again, the number was 488-8728, and you can also call City Hall 487-0672. And they can go ahead and direct you to that, to Mr. Milan's office.
All right. So if the panelists have completed with the data they're going to be sharing, we are open for questions. Open mic. Who's the person with that valor is going to say that first question? All right.
Hi, I'm Dalinda Guillen. It may sound like a silly question, but going back to Judge Vera's comments about the transfer station and taking tires, so is there, are people encouraged to go out and take their tires to the transfer station if they have any, and if so, are there costs associated with that?
There is no cost for the first 2 tires. Anything over that is $1 a tire because that's what it costs the county to dispose of them. However, we encourage people to take the tires to the transfer station and not to dump them on the side of the road because then it's more costly for us. We need to go pick them up and still have to pay that $1. So we encourage people to take them over there, and if for some reason it's a large number and they cannot make payment due to the circumstances that we're in, I'm sure we can work something out. Also, let me give a number for our planning department. And you can reach any of us on this number. It's 716-4800. And you can ask for me, ask for planning, ask for whoever, and they'll transfer you to the appropriate department. Yes, ma'am?
Yes, sir. Where is this transfer station located?
It's located where the old, dump area used to be on Charco Blanco Road, north of Rio Grande City, maybe a couple miles, 2 or 3 miles. If you're coming down Eisenhower and San Antonio, there's a sign there that leads you to the transfer station. Correct. Yes, ma'am. Well, it's not a dumping site, and I invite all of you to go look at it. It's really a state-of-the-art building. It's a warehouse, and they take the garbage there. It's dumped inside the warehouse, and then it's taken into containers, and we haul it out to a dump or a landfill in the Edinburgh area.
Any other? Here we go.
Yes, hello. My name is Marta Gonzalez, and we're coming from Miguel Aleman, and we are for the health department, and he's from the Bomberos. And my question is for doctors. We have a lady down there that he got sick by Zika, 22 years old. And the question is that how long did she have to wait for her to get pregnant? Because she got infected.
For female patients that have been infected, 8 weeks. In case of a male patient that is planning to have a baby with his partner, is 6 months. In body fluids, there are different times, blood, urine, feces, vaginal secretions, or semen, but semen has been the one documented to be presenting titers for this virus the longer, so that's why in males is recommended 6 months, in women 8 weeks.
Okay, thank you, because that's why we're here. We would like to know. Thank you.
We would like to add on into the information that we wanted to give to the community. And this is important because some of the questions from you all may come after this. As yesterday, we do have the first case of Zika virus in our city or in our county. It's a case related with traveling. It's not a case endemic to this area. Is not a case that has been acquired in our area. It's a female patient that has recently traveled to Mexico, Yucatan area, and came and soon after started presenting symptoms. It's seems like the confirmatory tests are going to come positive, and that's probably going to be included in the registry by the next week. So until then, we cannot confirm that this is going to be our first case, but it seems like this is going to be our first case. Yes.
Good morning. My name is Martin Rios. I work for the City of Rio Grande Animal Control. I got a question for Dr. Tyler. Dr. Tyler, like we always we're working with dogs. Say a mosquito bites a dog. can we, like, say, can the ticks or fleas can be infected to Zika? And then say, we can transfer it to us, like, say we get a tick or a flea bite?
So the question is, can a mosquito bite a dog and then transmit Zika to the dog, and then a tick or a flea pick up the Zika virus from the dog? And there's never been any documentation of that. There's only one flavivirus that's ever been documented in a tick, and that's up in the northeastern United States. I think it's a tick encephalitis virus. That's the only flavivirus that's ever been documented in a tick. And then as far as flaviviruses infecting dogs or domestic animals, there's never been. Wesselbrand's disease is a flavivirus that affects cattle, but there aren't too many flaviviruses that affect dogs or cats that I can think of. There are several flaviviruses that affect non-human primates. In fact, Zika was first discovered in a non-human primate, in a rhesus macaque in the Zika forest in Africa. But the answer, I guess, is no.
Thank you, sir. And I got another question for you.
Okay.
For repellent for a dog, we're talking about, now we're not talking about Zika, we're talking about ticks and fleas.
Uh-huh.
Okay, is it possible for us to pour on a dog, like, say, Silence or Ivomac pour-on?
So those are generally produced, I think, for livestock.
Yes.
Is that correct?
Yes.
And so typically they don't recommend off-label use in dog or cat species. There are other labeled specific products for dog and cats for fleas and ticks.
Thank you, sir.
Any other questions?
Alberto Perez, City Manager, Rio Grande. Got two questions. One is, what are we doing in coordinating and communicating with the ranchers? They have stock ponds everywhere. They water their cattle, their horses, to prevent this spreading. And number two, what are we doing as far as coordinating and communicating with our visitors from our neighbors across the river, and making sure that they send information to us when they have a case on their side?
So I think I can address the rancher question. Going back to the mosquito type and the biology behind the mosquito, the 80 species mosquitoes oftentimes are termed primate mosquitoes, in that they infect primates, non-human primates and human primates. And there's a cycle. Sometimes you'll hear the term sylvatic cycle and urban cycle, and the sylvatic cycle is from mosquito to monkey, back to mosquito, and the urban cycle is mosquito to human to mosquito. The dengue, yellow fever, Zika, all your 80s transmitted viruses have that life cycle. So with ranching environments, with ponds out in the country, they aren't as what's the word? It's like a niche. It's not a. They don't promote these type of mosquito growths. The type of container, standing water, stagnant water, are going to be flower pots in homes, or standing water where humans live, or where primates live, that will promote these type of mosquito growths. Your ponds out in ranches probably are more your floodwater type species, Serophora, those type of species. And then the second question you had was communication between our Mexican partners. And we have an Office of Border Health Services that does a lot of coordination and a lot of facilitating of communication, sharing of information from DSHS, and local health departments will also have coordination with our Tamaulipas and city health departments.
Let me add something to that. what are we doing in this binational communication? I think that we are doing a lot, but we have to do a lot more. It's important to keep us very aware of what is happening across the border, and as well as for them to know what are we doing. So anything that we can do towards improving and increasing the communication is something that definitely we have to put our efforts on. Also, I think that it's each country responsibility to try to take care of their own. This is a disease that it will be lost in the process if we follow the regular channels through communication. It's a disease that, I mean, it just takes for you to go across the border and get bitten by a mosquito, and a week later you are going to have the symptoms. So we already know that the disease is across the border as well as is here now. So we now need to emphasize a lot in that education to the public, that prevention of the spread of the disease, the spread and growing of the mosquitoes, avoiding the breeding grounds, avoiding going out in the times where the mosquitoes are more active, avoiding going out if you know that you are sick or if you have symptoms suggestive of the possibility of Zika virus, avoid going out and being an option for spreading the disease. So, I mean, we need to have a lot of self-control and education in our communities in order to try to contain it as much as possible. I also wanted to bring the issue of the school districts, and we have a representative here of the Rio Grande School District. I think that the school district had a very important role in helping us in education in this issue. Schools districts or schools are one of the places where gathers more of our residents. So education for them, their teachers, and their teachers bringing that to the students, so the student will bring that information to their house, should be very important. So I will encourage the school district to try to promote education within their employees, to bring it, trickle it down from the employees, the teachers, to the students, so they will bring that information home. Now, as we described early on, we do have the disease in our county. So now is when all of those different issues that we have tried to make aware comes to be important. So now we've already mentioned that there are 4 main symptoms that have this disease. So anybody could have this disease here at this time. So we will encourage to people who feel sick, fever, rash, conjunctivitis, and joint pain and swelling, to seek medical attention, and then for the healthcare providers to be determining whether this patient is a higher risk for Zika or no, or if it's worth it to follow the recommendations and to do the proper testing.
The time that you test the patient, or you feel that he has the signs and symptoms, and you test him, how much time between do you till you find out if he's actually a carrier or she?
It takes a while. There are initial testing that once they come positive, we need to go for confirmatory testing. So it is a lengthy process. Again, we have said before that there are just a few labs that are recommended in order to perform this testing, and it's all related with the local health department or the state health department or the CDC. So it takes some time, and as we have mentioned before, this is a disease that normally in 4 or 5 days it comes and goes. So it doesn't really have a repercussion in a patient unless it's a patient that is pregnant or is about to be pregnant. That's when we need to really be aware of the risk that that pregnant woman or that woman or men that are potentially father or mother a baby in the future are being exposed to.
And one more question, doctor. The prominent, we know that Zika can be anywhere or contracted anywhere, but where are the most prominent, when we say traveling, where are the most prominent areas at this time?
The whole America. It's unfortunately, if you see the map, it goes from North Canada all the way down to Tierra del Fuego in Argentina, including every single island of the Caribbean. So we are in the main endemic area for this disease at this time. It was a disease that before 2015 was identified mostly in Africa, Southeast Asia. Now we are, the Americas, from North America, Central America, and South America are the most endemic areas. Yes.
Most of the time we're out here patrolling and depending on the weather, usually wear short sleeve. Is there a specific insect repellent or will any one on the market do?
So the recommended insect repellents are DEET or EPA approved or EPA registered insect repellents, which also include percoridin and oil lemon eucalyptus. Those are the three that I come off the top of my head of registered, EPA registered.
There's no specific brand, correct? You can just...
There's no specific one that's recommended over another one, but DEET is, from the publications, DEET generally has the highest repellent activity of any other repellent.
Are there any like dangers from putting too much of this stuff on you or no?
Yeah, I think as far as toxicity goes, there's some cautions on how they should be handled in neonates or infants, and or you don't swallow it. Make sure it's topical. Don't put it in your eyes. Things like that. But there's some general guidelines on the toxicities.
All right. Thank you.
Yes. Here, my friend, she would like to know what repellent or what spray that is recommended for the human to put on. Any like off or any kind, or it's a special one?
It's what Dr. Tyler just mentioned. I mean, we don't have a brand that we could recommend that as long as he said is one of the most efficient ones, but any of the major brands of repellents are all of them authorized or approved, so we should be okay.
So that's no name, just a regular?
Yes.
Okay, thank you.
I'm sorry, I have one more question. I would like to take these back to our schools and hopefully get it to all our schools so that we could further pass on the information. Is anyone here from the Texas Department of Health where I can get these, or where could I get these?
I actually brought 5 boxes of those and other educational material that I was going to take to the Rio Grande City after this and pass out, so you can pick up through them.
Oh, okay, good. Thank you.
Visit with Mr. Milan, and yes, he has all literature for this, so please visit with him.
Thank you so much.
Thank you.
I was also going to touch base on your question about the turnaround time on the diagnostic testing. There's different types of diagnostic testing, and each type has different pros and cons. And I've always been in really close contact with Dr. Vasquez and the other city and county officials here. We've had cases where we discussed where we thought, oh my goodness, we might have a case, and it turns out it was a false positive test. And so there's a lot of stuff that go on behind the scenes that we do a lot of coordinating with. But there's one message that I think is really important for local healthcare providers is that arboviruses are reportable diseases. And in order for the public health officials to have time to respond in an effective manner, they should be reported to the local health authority, who's Dr. Vasquez. As soon as you're aware about it, aware of the case, the requirement is within a week, but we encourage, the sooner the better for any type of arbovirus or mosquito-borne disease.
Any additional questions, please? Any additional questions?
I'm sorry, you said Dr. Vasquez, you're
I am the county health authority.
Well, thank everyone for joining us. We have a table up in front with information about Zika and invite you to take with you before you go. If you have any questions or concerns about Zika in your neighborhood, please feel free to call the Rio Grande City at 956-487-0672 or the County of Starr at 956-716-4800.
At this time, I would like to just give a special thank you to Ms. Dalinda Guillen. A few weeks ago, or should I say a month or so, asked her if she could take on this coordinated effort to bring this conference together. And Ms. Guillen, thank you so much for making that happen. Certainly appreciate that. In coordination with Dr. Vasquez, Dr. Tyler, of course, and STC. So again, thank you. And if, for those of you that do not know, it's Ms. Dalinda Guillen is our director for EDC Rio Grande City. Thank you.
Thank you. We're done. Thank you very much.